We begin, though, this morning with clear signs of a setback in the fight against the coronavirus.
The CDC says the fast-spreading Delta variant now makes up 83% of all COVID-19 cases across the U.S. That's up from 50% during the first week of July. Coronavirus deaths are also up nearly 50% compared to last week. The CDC says the average of 239 Americans are dying from the virus each day. CDC Director Rochelle Walensky told Congress yesterday most of those deaths did not need to happen.
Each death is tragic and even more heartbreaking when we know that the majority of these deaths could be prevented with a simple, safe, available vaccine.
We've got it all covered for you this morning. Dr. Bernard Ashby is standing by in hard-hit Florida to break down what you need to know as the Delta variant spreads. First, let's get a closer look at the challenges that one hospital is facing. NBC News correspondent Ellison Barber is at the Lexington Medical Center in West Columbia, South Carolina. Hospitalizations are back up. Nearly every COVID patient there is unvaccinated. Ellison, I know you were at this hospital before around this time last year. So tell us, what's the situation like now and how does it compare with what you saw a year ago?
Yeah, I mean, it's been almost exactly 1 year since we went into the designated COVID ICU ward they had at this hospital. They officially closed that designated ward in mid-March, but now they're having conversations about whether or not they need to reopen it because they saw the number of ICU, intensive care COVID patients, jump from 0 to 8 in just 1 week. When we were there yesterday, there were 9 COVID patients in ICU. One of the patients was brought while we were there on the floor. The vast majority of them unvaccinated. The biggest outward noticeable difference was the ages in these patients. When I was in the COVID ICU ward last year, most of the patients that I saw were older, in their 70s and their 80s. The youngest one on the floor at the time was a fairly young grandmother, but in her late 50s, early 60s. Yesterday, when we walked onto that floor and we saw the COVID patients, one of the first things I noticed in 3 different rooms was that they all looked like they could have been about my age. The first patient we saw who was intubated, sedated, receiving a plasma exchange treatment was just 26 years old. Across the hall from him was someone in their early 40s. Next to that person was someone in their late 30s. Doctors are worried that if something does not change, they could be headed right back to where they were this time last year. Listen to what one of the ICU doctors told us.
And that I think we've seen how bad this can be. We've seen the effect on people and families. We've seen the effect on the community in every way. And it's, you know, and none of us want to get back there.
They have about 20 COVID patients at this hospital as of yesterday. We're told all but 3 of them are unvaccinated, but doctors say the ones who are unvaccinated tend to have other conditions, other comorbidities that ultimately led them to need hospitalization in addition to having COVID-19. One of the key things doctors say they are noticing among the younger unvaccinated patients is that they largely don't have any pre-existing conditions. Some are considered medically overweight, but other than that, there's nothing else indicative in their health history that would make them be at a higher risk of getting a severe case of COVID-19.
So,
Joe?
Ellison, focusing on the unvaccinated, I know you spoke to one patient who was in that hospital for 2 months. What did he tell you?
Yeah, he spent 2 months in the ICU, 2 months in the hospital, rather, a couple weeks in the ICU, and he was sedated, intubated on a ventilator. He told us that his family was told to go ahead and start considering funeral arrangements and plans because they were not sure and at one point really didn't think that he would survive. He was not vaccinated, even though he was eligible to be vaccinated much earlier in the year. He said that at the time, he just didn't feel like he knew enough about the vaccine. He thought it was too new and wasn't sure if it was risky. He decided he didn't want to get it. He says that it is a decision he now deeply regrets, and he will tell anyone who will listen he wishes he'd gotten vaccinated. Listen here.
I would tell them, like, yeah, go ahead and get the vaccination, because the COVID is for real. Like, it had me on my dying bed, and I didn't know whether I was going to make it back or not.
He spread the virus to his mother when he got sick in April. He said his mom had already had 1 dose of a COVID-19 vaccine, Moderna, and she was not nearly as sick as him. He thinks it's because she'd already had 1 dose where he had not had any. Joe.
Ellison Barber with a return trip to a hospital, one we were hoping you wouldn't have to make. Ellison, thank you.
New research from the CDC shows just how devastating COVID-19 has been. The data shows life expectancy in the U.S. dropped by 1.5 years in 2020. That's the largest decline seen in a single year since World War II. I want to bring in Dr. Bernard Ashby, a cardiologist based out of Miami. Doctor, good morning. Thank you for being with us. Let's start with the situation nationwide right now. New COVID-19 cases, hospitalizations, deaths, all those metrics are back up because of this highly transmissible Delta variant. Is this a resurgence? Is this a fourth wave? How worried are you about where the country might be headed and what this means? Is this lockdown again? What do you think?
Well, good morning, and it's a pleasure to be here, and it's a pleasure to speak on behalf of other medical professionals in my community. So basically, what we're dealing with is a new variant that, in a lot of ways, is more transmissible, and the exact mechanism is related to the fact that it has a shorter incubation period, and it has a much higher viral load. In fact, it's at its peak, it's 1,000 times higher, the viral load, than the previous variants that we've dealt with. And we've seen in India, where this Delta variant has ravaged that country, and around the world where it's ravaging other countries, including Thailand, including some countries in South America, and it's predictably doing the same here. But the difference is that we have a much higher degree of immunity, whether it be through the vaccines or through prior infection, that we won't see the same peak levels that we saw earlier in the pandemic.
Well, that's a little bit of good news there then. Now let's talk about your state, Dr. Florida. That's where 20% of the country's new coronavirus cases are coming from, according to White House officials. What can you tell us about what you're seeing firsthand happening in your state and who's most at risk there right now?
So it's very interesting. Florida kind of has an inverse relationship to the rest of the country, mainly the Northeast and the other colder climates, with regards to when and how we surge. So during the summer, that's really our winter equivalent, where a lot of folks are indoors because it's so hot and humid outside. And as a result, that behavior increases your risk of getting the virus. And it's quite evident that the vaccines are very effective. And what we're seeing is that the infection rates are highest, and the death rates and hospitalization rates are the highest in those who are unvaccinated with no immunity whatsoever. And unfortunately, it's disproportionately impacting communities of color, low SES communities, especially communities where they tend to cohabitate and have multi-generational homes. So, this is it's actually having a desperate impact on certain demographics, particularly in Florida. And our governor, unfortunately, has not taken the proactive steps to deal with this, and unfortunately has remained in a reactive posture, much to the detriment of our population.
Dr. Bernard Ashby, thank you so much for joining us this morning.
Thanks for having me.
COVID is hitting Team USA again. Another American athlete tested positive for coronavirus this morning. It's U.S. men's volleyball player Taylor CRABB. He's joined the growing list of Olympians contracting the virus. The 29-year-old Olympian from Hawaii was scheduled to play his first match Sunday against a team from Italy. NBC News Now correspondent Isa Gutierrez joins us now with more. So, Isa, Taylor CRABB plays beach volleyball. A reminder to folks, that's a two-person team. What does this mean for his Olympic dreams, and how about the dreams of his partner?
Yeah, Joe, Taylor was expected to play his very first game on Sunday against Italy with his partner. Of course, now that he's tested positive for COVID-19, he's in isolation away from the rest of his teammates. This means that he likely will not be able to play in the games. And another player, Tri Bourne, who's a former standout from USC, just arrived in Tokyo today. He's expected to replace him and play with his partner this weekend and for the remainder of the games. Meanwhile, Taylor's brother, who's was also a professional volleyball player, said that this is just a terrible situation for him. He also said that in his personal opinion, his brother, even though he has tested positive for COVID-19, should still be allowed to play and is, quote, fine and healthy. Joe?
Yeah, something tells me that is probably not going to happen, at least anytime soon. So how are these new positive cases affecting other athletes on Team USA? They have been training for years. They've had to wait an extra year. I'm betting they just want to start competing as soon as possible. What are they saying?
Yeah, we've heard from athletes that this is just really a terrifying situation for many of them. For example, third-time Olympian April Ross, she's a beach volleyball star. She's saying that this time around, these cases are really a huge topic of conversation among the athletes. Take a listen to what she said.
When another case, is kind of comes up or found out, it's like, oh my gosh, did you hear this person, that person? And it's really heartbreaking every time you hear that. And actually pretty shocking because of all the precautions we had to take before we left and what's on the line. And I know everyone I know was really careful. And so it's kind of like, then this person was vaccinated and they still got it. And it's just shocking and it's scary.
April said that this has made her realize that these athletes have to be really careful, even though they are vaccinated, especially in a place like the Olympic Village, where there are many crowds, she says, thousands of other athletes from around the world. She also said that she feels that on the ground, protocols aren't really being enforced very much, such as mask wearing and social distancing. So she feels like it's really up to her and the other athletes to really protect themselves. Joe?
No doubt they're taking this seriously. So, Issa, the Olympics opening ceremony is the day after tomorrow on Friday. I understand even now questions still swirl around the future of the games, even though some competition has already started.
That's right. Yeah. So the Tokyo Olympics president was asked directly yesterday whether these rising infections would impact the games, if they would be delayed or if they would be even canceled down the line. Potentially, he did not give a definitive answer on that, other than saying that they would just keep a close eye on these COVID-19 cases. But like you said, the games have really already begun, even though the opening ceremonies haven't happened yet. Team USA already won their first game, bringing home their first victory. The women's softball team played against Italy today, and we're expecting to see more games that are scheduled over the next couple of days as well. So the show's going on for now. Joe?
And Team USA off to a good start on the softball field. All right, Issa Gutierrez, thanks so much.
All right, sparks were flying on Capitol Hill yesterday as Kentucky Senator Rand Paul and Dr. Anthony Fauci faced off yet again during a coronavirus hearing. This time, the senator outright accused Dr. Fauci of lying. Take a listen.
Dr. Fauci, knowing that it is a crime to lie to Congress, do you wish to retract your statement of May 11th where you claimed that the NIH never funded gain-of-function research in Wuhan?
Senator Paul, I have never lied before the Congress, and I do not retract that statement.
All right, let's bring in NBC News Capitol Hill correspondent Leon Caldwell, who can tell us a little bit more about those sparks that were flying. This isn't the first time these two have clashed on the Hill, but it did get pretty intense. Can you tell us more about what happened and why?
Good morning, Savannah. You're right. It's not the first time the two have clashed. They've clashed over the origin of coronavirus. They've clashed over mask wearing. But yesterday was probably the worst. Now, Senator Paul was charging Dr. Fauci and the NIH over funding what is called gain-of-function studies. And that's a controversial way to make viruses more potent, to study how they are spread and how to treat them. Now, Dr. Fauci denies that the NIH ever did this. And let's listen to more of what happened yesterday.
This paper that you were referring to was judged by qualified staff up and down the chain as not being gain of function.
So
let me finish.
You take an animal virus and you increase its transmissibility to humans. Right. You're saying that's not gain of function?
Yeah, that is correct. And Senator Paul, you do not know what you are talking about, quite frankly. And I want to say that officially. You do not know what you are talking about. And you are implying that what we did was responsible for the deaths of individuals. I totally resent that. And if anybody is lying here, Senator, it is you.
So a really intense exchange between the two. Of course, there are questions about the origin of coronavirus. It's something that conservatives, especially people like Senator Rand Paul, have really been honing into. And we saw that manifest yesterday in that exchange, Savannah.
Yes, we most certainly did. All right, Leanne, let's stay on COVID and the Hill. There's been a development in the case of those Republican lawmakers who refused to wear masks on the House floor when it was required. What's the latest development there?
Well, they were fined $500 at the time, which is what the punishment was that was instituted at the time. And these lawmakers appealed, and they lost that appeal. And so the point is there's still lots of battles up here on Capitol Hill over coronavirus, but we are seeing some Republicans, not the three that you just saw on the screen, like Marjorie Taylor Greene, but others who are really starting to push people and their voters and their constituents to get vaccinated. We heard that from Senate Minority Leader Mitch McConnell yesterday, even GOP Whip Steve Scalise from Louisiana.
All right. And Leanne, finally, before I let you go, we think it might finally be Infrastructure Day. We'll see how this all plays out today. But Senator Majority Leader Chuck Schumer is pushing for that procedural vote today to get infrastructure legislation moving. This was his Wednesday deadline. He's trying to stick to it. Republicans say, though, that Democrats are accelerating the process before it's ready as these negotiations still play out. What happens if this vote fails?
That is the question that Democrats who are in control of the Senate are not letting on to. They are insisting that Republicans should vote to start this process. This group of 22 negotiators on this bipartisan infrastructure bill worked late into the night. They are making progress, but they still don't have this legislative text. So we're going to see if Republicans decide to block this, and if so, how Democrats respond. Savannah.
All right, Leanne Caldwell, we'll be checking in with you on that. Thank you so much.
Yeah.
Former President Trump's inaugural committee chair is facing federal charges accused of acting as an agent for a foreign country. 74-year-old Tom Barrack, a longtime friend of Mr. Trump, is accused of working on behalf of the UAE, the United Arab Emirates, and lying about it to federal agents. NBC News correspondent for investigations, Tom Winter, joins us now. Tom, first of all, just lay it out for us. Explain what charges is Barrack facing?
Well, it's a whole host of different charges, but it really centers around two specific areas. One, that he failed to register as a foreign agent working on behalf of the United Arab Emirates. And then the second is that he lied to the FBI in several different ways. Basically, what they're saying here, Joe, is that from April 2016 to April 2018, so both while Trump was a candidate as well as once he was in office, that Tom Barrack essentially acted as an agent of the United Arab Emirates. How did he do that? A couple of samples of that include editing a speech that the president gave to be more favorable to the UAE, op-eds that Tom Barrack participated in, interviews that he participated in, and as well, and perhaps most important here, is that he passed along information, sensitive non-public information about what other Trump administration officials were thinking or what they believed as it related to the Middle East and to UAE. So some pretty significant allegations here. Barrack has denied that he's done this. He says that he's going to plead not guilty, and he says that he's spoken with investigators in the past, Joe.
You know, Barrack has been friends with the former President Trump for years. I think we heard about his influence, especially during the 2016 campaign, saw more as the inauguration approach. But what sorts of ways is he accused of actually trying to influence the former president?
You know, I think when you look at the charges here, the idea that he was involved with editing a speech and involved in speech writing, I think is, you want to talk about foreign influence. I mean, this is one of the most brazen efforts that we've seen in a very, very long time when you have somebody that can get in the president's ear. On top of that, they talk about that there was a meeting in a summit potentially at Camp David involving several new Middle Eastern countries, and that after Tom Barrack called the White House, that meeting was canceled. So, yeah, those are pretty significant efforts.
And Tom, as you mentioned, Barrack's lawyer says he does plan to plead not guilty. But if he is convicted, what kind of penalty could he face?
Typically for a FARA charge or for lying to a federal agent, they're not particularly stiff penalties here. It says up to 5 years. Nobody's ever been given up to 5 years in prison for this type of thing. But he does face jail time. Jail time has been handed out in the past in some of the cases brought by Special Counsel Robert Mueller. So it's certainly not out of the question here that he does face jail time, which is where he is today, Joe, who's still behind bars awaiting a bail hearing.
All right. Tom Winter. Tom, thanks so much.
Sure thing.
It is time now for a check on your morning news now weather, which means Bill Cairns is with us. Hey, Bill.
Hey, good morning. How about that smoke and haze yesterday, guys?
I know.
It was it was one of those rare events where the East Coast even gets it. And, the smoke traveled all the way from Western Canada, British Columbia, where they have a state of emergency in effect, by the way, because of the wildfires. Some of the smoke was from Northern California and that bootleg fire in Oregon. And it just made for an eerie scene. I mean, I could smell it outside my house. It was one thing to kind of see it, but to actually smell it in the air, it was just incredible. And they say it was the worst air quality in New York City in 8 to 14 years. That's how many particulates were in the air. So this is what it looked like. The clouds are shown in the bright white down around South Carolina, North Carolina, and then that hazy stuff out through the Ohio Valley in the Northeast, that was actually the smoke that was showing up behind satellite. So pretty incredible stuff. So we have a pretty quiet start to the morning in the Northeast right now. We had some pretty good thunderstorms last night around Binghamton and around Albany, but that cold front is still there. So as we get the heating of the day going, it'll spark up new storms, probably a little early, around 1 to 2 p.m., I'm guessing, is when the storms will fire up. Then they'll slide through Boston, Hartford, Providence, New York City, Long Island, all the way down the Jersey Shore, including Philadelphia, and then they'll pass off the coast pretty early. So 37 million people at risk. Damaging wind and large hail with the storms today are possible. I don't think we're going to see too many tornadoes. Here's kind of the timing of it. Not a lot of showers out there early. There you see around 2 p.m. some pretty good-sized thunderstorms there in Connecticut, New York City area, the Jersey coastal locations, and just south of Washington, D.C. The good news for this is you have afternoon and evening plans. By about 6 to 8 p.m., it's gone through all of the Northeast. The rest of the country, hit and miss showers and storms in the Southeast. Still pretty hot in the West, especially in the northern plains. And tomorrow, we should see a couple 100s once again in Montana and in areas of the Dakotas. So we'll talk more next hour about the fires that produced that incredible smoke and what the status that they are. And I don't know if you saw this yesterday, but people are saying and reporting some of these fires are creating their own weather. I'll let you know if that's a myth or maybe that's true coming up.
I did see that, and we love when you give us a tease, Bill. But yeah, wow, this wildfire season already, it's not good.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.